Hello and welcome to Creating a Welcoming Health Center for Youth. My name is Sasha Faust and I am your trainer. I work at Access Matters. We are a Philadelphia-based nonprofit with national reach through our training program, and I have been with Access Matters for 4 years now. Access Matters' vision is that every person has the healthcare and information they need to thrive. And our mission is to protect, expand, and enhance equitable access to sexual and reproductive health care and information for all people. And that includes the young people that we will be centering today. By the close of this webinar, you should be able to identify 3 barriers youth face when getting healthcare, describe 2 strategies to support LGBTQIA+ youth in your practice, and summarize 2 components of youth-centered care as defined by the World Health Organization. So let's talk fundamentals of youth-centered care. First off, we should specify who we're talking about. According to the World Health Organization, adolescents include individuals between ages 10 and 19. Youth encompass individuals between the ages of 15 and 24. So there's some overlap there. You'll also notice that this includes young adults. So just because somebody is a youth does not necessarily mean that they are a minor. Those are not interchangeable necessarily. So today we will use the term young people or youth as an umbrella term to describe any young people who may be seeking family planning services or other services that they're eligible for at your clinic or your healthcare center. And according to the US Census, there are roughly 42 million young people in the United States between the ages of 10 and 19. And that is a not insignificant number of people. That is a large portion of the population, and those are folks that may need services and may not know where to get them. And it is on us to make sure that they can, and that is what today's talk is all about. So what does it mean to center youth in your practice? It means respecting youth as individuals with personal autonomy. That means that they have the right to make decisions for themselves by virtue of being a human being. You know, bodily autonomy is a human right, and they, have a say in what happens to it and what decisions they make regarding their own bodies. You should support youth empowerment. So that means making sure that young people are a part of the decision-making process, that they are not coerced into making certain decisions about their healthcare based on what other people have decided for them. It means young people's goals and personal choices and beliefs and needs are centered in the shared decision-making process, and that it's a collaboration, not so much an authority figure, a provider telling a young person this is what you ought to do. So young people have to be a part of that process. And it also means that services are available and appropriate to all young people who need them. And that requires addressing barriers to care materially and meaningfully. And we will talk a little bit about what that means when we talk barriers to care. So there are a lot of barriers standing in the way of young people getting the health care that they need. Could be time constraints. Clinic hours may not line up with the school day or the work schedule, and so it may be difficult to get there or to get an appointment where it doesn't coincide with another obligation. Financial ability is a concern. Young people are generally not financially independent. They are youth and they are dependent on their parents or on their guardians or other family members to get what they need. Young people might not have insurance, or they might be on their parents' insurance. They may be concerned about out-of-pocket costs if they don't have insurance, or they might have questions about how to use insurance at all. And there may be concerns about confidentiality in regards to that insurance if they are on their parents' insurance. School work obligations can get in the way of being able to get care. Concerns about cultural responsiveness of staff. So you'll note we use cultural responsiveness instead of cultural competency because it is not possible to become culturally competent in somebody else's culture. If you are not a part of that culture, you cannot become competent in it. You know, other people's cultures are not hobbies for us to take on and try to become competent in. Instead, you know, we encourage increased sensitivity and consciousness of other identities, of other cultural backgrounds, of being able to ask folks what it is they need, you know, what kind of accommodations they may need due to religious reasons, cultural reasons, etc., and to be responsive to that. That it is not a one-size-fits-all, this is just how we do things here because this is our culture, but that staff is responsive to the cultures of other people, of their diverse communities that they serve. Language barriers, so whether interpretation services are easy to get, whether they're available on demand, and whether they cover the languages that are needed for, you know, folks that may be requesting them. Concerns about confidentiality, you know, if you're under 18, there are limits on what you are permitted to do or decisions you are permitted to make about your healthcare. And that might mean, you know, an EOB, an explanation of benefits, going home to someone's parents, listing a family planning visit that they hope that their parents wouldn't find out about. It may be because they are set to do a telehealth visit and they have to do it from their home, and perhaps their parents or their guardians don't know that they're seeking family planning care or any other kind of healthcare services. So confidentiality is especially important as the landscape of virtual healthcare provision continues to shift and continues to change. We have to find new and different ways to preserve the confidentiality of our young patients, and not just young patients, but our adult patients too, of course. And young people are frequently not aware of services, and they're also not aware of their rights as patients. I know that when I was in high school, I had no idea. In fact, it never even occurred to me that I, as a person under the age of 18, would be able to access sexual health services or reproductive health care services. It would never have occurred to me because nobody told me. Nobody told me, and there was really no way for me to find out unless I went looking on my own. And I didn't, because I just assumed that's just how it is. You have to be 18 in order to do those things. So a lot of young people are on the same page, and they don't know that they are actually entitled to certain services and that they don't need parental consent or guardian consent in order to access them. Transportation issues. Not everybody drives. Not everybody has access to a car. Not everybody has access to public transportation. Folks who, let's say, use wheelchairs may not be able to get there if the bus doesn't have a wheelchair ramp, or if there isn't a bus that comes to them. So there are a lot of barriers in regards to just getting to the clinic, physically getting to the clinic, that can get in the way of getting the healthcare services that a young person needs. And young people bring, like anybody else, their past negative experiences with them. Young people may have trauma in regards to their sexual health, in regards to their own personal history, their home life, their interactions with the healthcare system, and folks bring that with them when they come to the doctor's office. You know, humans have no choice but to be whole people all of the time. We cannot opt to leave our trauma at home, okay? That we carry that with us. And so if a youth has had traumatic past experiences in regards to getting healthcare, that's something they're going to bring with them, and it may impact the way that they show up in your practice. And so it's important for providers to be trauma informed and to, again, respect, the fact that young people are whole human beings too, and they are going to bring that with them, and we need to work with them based on, where they're coming from. So I want you to take a moment to think about what barriers impact the communities you serve. Is it COVID? COVID's impacting all of us. How has COVID-19 and the move to telehealth impacted how young people are getting healthcare now? Are you seeing fewer young people as a result? Are you seeing more young people as a result? Do you serve communities where immigration status may be an issue or a barrier in getting healthcare? Is immigration status a barrier to healthcare at your practice? Are there policies in place that preclude certain people from accessing services based on their residency status? The World Health Organization has 8 global standards for youth-centered healthcare services. Basically, they wanted to set the standard for, this is what you should strive for as a youth-centered healthcare service provider. Standard number 1 focuses on adolescents' health literacy. So that means that the health facility implements systems to make sure that adolescents are knowledgeable about their own health, that they're able to give informed consent, that they have the knowledge that they need in order to make choices that are right for them, and that they know where and when to obtain those health services, so that they know that they have a right to access family planning services, etc. Standard 2 describes community support, that a health center cannot center youth in a meaningful way if the community does not support that health center providing services to youth, because it will make it more difficult for the health facility to provide care, and it also makes it more difficult for young people to go and get care if the people around them do not support their ability to. So the health facility implements systems to ensure that parents, guardians, and other members of the community recognize the value of providing health services to young people and support that provision and the use of those services. Standard 3 describes the appropriate package of services. So information, counseling, diagnostics, treatment, and care services that fulfill the needs of the adolescents that visit their clinic, of all adolescents, and are inclusive of all of those needs. That means that those services are provided in the facility or through referral linkages and outreach. So if there are additional services that are needed that are not provided on site, making it as clear as possible where to get that follow-up service, how to get it, making sure that the young person knows when and how to access it, making it as easy as possible, as easy to understand. That is what it means to package services appropriately for young people. Standard 4 describes providers' competencies. So healthcare providers should demonstrate the technical competence to provide the effective healthcare services that young people need. But healthcare providers and support staff both need to respect, protect, and fulfill adolescents' rights to information, privacy, confidentiality, non-discrimination, and that there is a standard of respect toward youth. Providers' competencies can be built through training. So, this right here is an opportunity to build provider competencies in youth-centered healthcare services, but receiving regular training, getting further education, all of that can help build those competencies in order to address these needs more meaningfully. Standard 5 describes facility characteristics to youth-centered care. So the health facility has convenient operating hours. So convenient operating hours for youth. that it is a welcoming and clean environment, that they're following privacy policy and confidentiality to a T, that they're sticking to the policy and they're doing what they say, that they have the equipment, the medicines, whatever technology is needed to ensure that young people are getting quality and effective services. Standard 6, equity and non-discrimination. It is not enough to write a policy on anti-discrimination if there are not accountability measures to back that up. So not only must a health facility provide quality services to all adolescents, regardless of their ability to pay, their age, their education level, their gender, their sexual orientation, their immigration status, their ability level, all of these things are a part of equity. And all of these things need to be named explicitly in anti-discrimination policies. And like I said, accountability measures have to be put in place as well to ensure that folks are meeting that. Because it's one thing to write it on your website, but if it's not anti-discrimination in practice, then that policy doesn't mean anything. Standard 7 describes data and quality improvement. So the healthcare center should be collecting, analyzing, and using data on service use and quality of care. They should be able to take a look at, which age groups are accessing which services. Are there gaps that we could be doing more to meet, right? So using that data to improve services, to improve service utilization, as well as quality of care is really important. And health facility staff is supported to participate in quality improvement. So staff needs to be a part of that process as well. Standard 8 requires adolescents' participation. Your services cannot be youth-centered if they do not center youth in the planning, monitoring, and evaluation of health services, as well as in decisions regarding their own care as individuals. So, like we said before, young people have personal autonomy. They have bodily autonomy by virtue of being human beings, okay? Bodily autonomy is a human right. Young people and adults alike should be able to access healthcare services free of coercion, free of judgment, and should feel free to be a part of that process. So again, shared decision-making is one way to increase adolescents' participation, ensuring that young people's goals and their needs and their values are being centered in the decision-making process. All of that goes to adolescents' participation in the process of getting care. Additionally, there are some characteristics which make a healthcare center more accessible. Accessibility means making services as easily obtainable to the people who need them. And, of course, we're talking about young people, but we're talking about young folks of all different abilities, of all different backgrounds, of cultural backgrounds, of all kinds of histories, coming with trauma histories that are different, coming from different financial statuses. So folks are coming from all kinds of diverse communities, diverse identities, and accessibility means making services easily attainable to all of those folks. Even if it's just one person who needs a special accommodation to get what they need, you must provide it, because inequity toward one person is one too many. Affordability is an aspect of accessibility, because if you can't afford it, you can't get it. Nobody should have to shortchange the getting care. They should not have to put off getting the healthcare services that they need for fear of not being able to afford it. The fear of affordability or of inaffordability is a huge barrier to getting care. So even if the clinic offers services for free or low cost to young people, if young people don't know that, then it doesn't matter. They're not going to know that they can use them. Physical access to the space for all is important. So if the healthcare center is really far from the school, or really far from, you know, community centers or wherever else young people in the before times would have been congregating, that is an issue. That is a barrier. You know, not everybody has access to public transportation. Not every town has public transportation. Not every young person has a driver's license or access to a car. And so that is just an additional barrier if the healthcare center is super far away from the folks who need to use it. Now that, of course, is not necessarily within your control. You know, you can't Wizard of Oz lift the house and drop it somewhere else, right? But it is something to consider, you know, perhaps when building a new healthcare center or when considering shuttling services or any other number of, you know, improvements in order to make that distance a little smaller. You must also ask yourself, can youth with physical disabilities access your space? You know, do you have a wheelchair ramp? Do you make it easy on folks who are disabled to enter the building? If you have just one patient who uses a wheelchair and you don't have a wheelchair ramp, that is one person too many. You know, it is crucial that accessibility is available to all. It means making sure that everybody can get what they need, that we're not making it harder. And it doesn't matter how few folks need that accommodation, you should provide it. With language and communications, it's really important that materials are available in multiple languages, that they're available in the languages that are being requested by the people who need them, that they're comprehensive. So, you know, consider what is the reading level that we are producing our copy at? You know, is it a college reading level? Because if it's a college reading level, there are going to be a lot of folks reading your materials and having trouble with it, or perhaps not even being able to read it. Are interpretation services easy to get? Are they available on demand, or do you have to schedule it in advance? Do they offer the language that is needed, that is being requested? Are young people able to use those services as well as adults? You know, are you providing the same level of accessibility to your young patients as you are to your adult patients? Again, are materials accessible for students of all abilities? So, you know, are you considering the fact that you are serving populations of folks that perhaps are on the autism spectrum, or maybe have, you know, challenges with reading? You know, these are considerations that healthcare providers need to make, because if you're missing just one person, that is one person too many. It is important to prioritize accessibility, physical accessibility, financial accessibility, etc. Hours of operation, you know, are you limited to during the school day? Or do you have flexible hours where folks can walk in without an appointment? Do you have drop-in hours perhaps on, let's say, a Tuesday evening where folks can come in between, you know, 5 and 7 anytime and have a checkup? You know, are these things that you're able to offer? If you're only able to offer traditional business hours, then that can be a barrier to young people because they are not necessarily abiding by those traditional business hours. Those might not be helpful for them. And not just for young people, but for adults that work non-traditional hours as well. While we're on the topic of supporting youth, it is super important that we're providing affirming care for LGBTQIA+ youth. So just a review of what the acronym here stands for. LGBTQIA+ stands for lesbian, gay, bisexual, transgender, queer, questioning, intersex, and asexual. The plus is to encompass identities that are not included in the acronym. And of course, this is an acronym that is constantly in flux. Folks use different ones, but this is the one that we're using today in an effort to be as inclusive as possible. LGBTQIA plus youth are at higher risk for the following than their cisgender and heterosexual counterparts. And we will be defining what those terms mean in the next slide or so. Substance use, STDs or sexually transmitted diseases, suicidality, homelessness, cancers, anxiety, depression. And LGBTQIA plus youth are less likely to receive quality care due to stigma, healthcare providers with inadequate training, and insensitivity toward their unique needs. So I want to give a little crash course in gender on what some of these terms mean. Assigned sex is a determination made by a medical provider, a midwife, whoever is delivering the child. It's a determination made by that person at birth based on physical characteristics, more often than not genitalia. So it is a designation that is made based on the physical appearance of a baby's body parts. So the check goes next to female or it goes next to male on the birth certificate, and that is what assigned sex is. Less often assigned sex or sex assigned at birth, as you may hear it referred to. Avoid the term biological sex. That is an inaccurate term. Assigned sex or sex assigned at birth is going to be a much better term to use, a much more appropriate term to use. Less often, assigned sex is based on other factors like chromosomal testing or internal anatomy. But chromosomal testing and internal examinations are things that usually come later in life, and only if there are health indications that a person needs chromosomal testing. So that's not something that happens commonplace. It is basically based on genitalia. And everyone has one. Everyone has an assigned sex. So often, straight and cisgender folks tend to think that assigned sex, gender identity, all of these things, dare I say this gender stuff, is only for LGBTQIA plus people, that it doesn't apply to everyone else. Like when we talk about pronouns, there are folks that say, well, I don't use pronouns. I don't really understand this pronoun stuff, but everyone uses pronouns, everyone. And so it's important to take this information to heart and to apply it, to use it, because it applies to everyone. Gender identity is one's innermost sense of who they are, whether they are woman, female, man, male, both, neither, or something else entirely. Perhaps their gender identity it fluctuates as well. That gender identity can change over time. And everyone has one. Everyone has a gender identity. My gender identity is that I'm a woman, okay? And my assigned sex is that I'm female. And that makes me cisgender, which is an adjective to describe gender in which gender identity and assigned sex line up, meaning they are the same. They're on the same side of. That is what cis means. It means same. It's a Latin term for same. And so cisgender means on the same side. It's abbreviated as cis, so you may sometimes hear cis as to shorten it. Transgender is an adjective where trans means on the other side of. So it describes gender in which gender identity and assigned sex do not match up. Now, it doesn't mean that a person may necessarily seek gender affirming surgeries or medical interventions or medical treatments. It is enough to simply have a gender identity that doesn't match up with someone's assigned sex to be trans. If somebody shares with you that they are trans, believe them. There is no litmus test for what makes a person trans except identifying that way. So do keep that in mind and do avoid making assumptions based on what people look like, how they present, And we'll talk about how to provide better care to folks who are trans and gender nonconforming. Now, a little bit of a crash course in sexuality, because this is something totally distinct from gender. Now, that may be a little confusing when you look at the acronym, because transgender regards gender, whereas all of the other identities regard sexuality. So sexual orientation describes a person's sexual attraction to others. It's who you're attracted to. It is totally separate from gender identity. Being trans does not automatically mean a person is gay. A person who is trans can have any sexual orientation. A transgender person can be straight, can be bisexual, can be queer, can be any number of things, in the same way that a cisgender person can be straight, can be queer, can be pansexual, can be any number of things. And everybody has one, okay? Even asexual people, because asexuality is a sexual orientation that describes the lack of, or the absence of, the experience of sexual attraction. But it is a sexual orientation. Everybody has one. And it's really important, as especially as medical providers, to understand that sexual behavior can differ from a person's orientation. So make sure you're checking assumptions about what kind of sex a young person is having, or who their partners are, or what their partners are like, based on their orientation or gender identity. Ask about what their partners are like instead of assuming. This does not just apply to LGBTQIA plus young people. This is an issue that, that often comes up at the GYN office for straight cisgender women who, may be asked whether they are sexually, and not just straight women, but cisgender women who are asked, are you sexually active? And the medical provider is asking that question when really what they should be asking is what kind of sex are you having? What is the sex of your partners? Because what does sexually active mean? Is the provider making an assumption that because I say I'm sexually active, that means I'm at risk for pregnancy? If they're not asking me who my partners are, then how do they know what I'm at risk for in terms of pregnancy, for example? If I'm sexually active with another cisgender woman, then I may not be at risk for pregnancy. But if we're not asking those specific questions, then we're not getting that information. And we need that information in order to provide effective care that is specific to folks' unique needs versus one-size-fits-all approach, because we know that doesn't work. The Gender Unicorn is a great learning resource from the Trans Student Educational Resource Center. And it is an organization that is run by trans young people, youth activists, and they put together this graphic to show how these different categories of identity kind of look parsed out. It gives a visual to how some of these things work and what these continuums kind of look like. And this is something that you can hang in your office, that you can hang at the healthcare center, next to your desk at home if you have a printer. But it is a great graphic to talk about the different categories and the different dimensions, not categories, but dimensions of sexual orientation and gender diversity. So how do we use forms and documentation in order to yield quality information, sound information, in the most trauma-informed and sensitive and inclusive way? Intake forms are often a source of trauma and re-traumatization for LGBTQIA+ patients. LGBTQIA plus patients, especially transgender and gender nonconforming patients, are frequently forced to answer inaccurate, imprecise questions that force them to misgender themselves, and in turn lead center staff to do the same. And to be clear, to force a client to mark a gender that does not align with how they feel is to mischaracterize their humanity. And that is the opposite of affirming care. It is a form of violence to force young people to put themselves in boxes that other people have set up for them. And not only do these questions become a source of trauma, they also won't yield accurate data. A poorly designed form, even if it's super well-intentioned, is not going to give you the information you need to provide good quality healthcare to patients if that form is not asking the right questions. If you're not asking the right questions, then how do you get the right information? So you have to ask yourself when it comes to reviewing your forms and documentation, what information do I need to provide care to my client? What questions do I need to ask in order to get that information? And what are the best practices to do that? So some best practices for supporting LGBTQIA plus youth at your practice is yearly trainings for all staff in sexual orientation and gender identity, not just client-facing staff. And yes, your bosses should be there too. This is information that as time moves on, we find new ways to describe different sexual identities and gender identities. We develop new language to talk about these things. And so it's important to stay updated, to the best of your ability, and to make sure that everybody is receiving that education. Because that is basic stuff, making sure that everybody is receiving trainings on sexual orientation and gender identity, and that the people leading those trainings are members of that community to give that training, okay? So hire LGBTQIA people to do your sexual orientation and gender identities. There are lots of us out here who do these trainings and are waiting for your Zoom call. Accessible restrooms. So we talked about accessibility before. Specifically when it comes to accessibility for trans and gender nonconforming young people, designate all gender bathrooms wherever possible and make sure that folks can use the restroom which aligns with their gender. So it may not be possible to have single occupancy restrooms, depending on the setup, but make sure that patients can use the restroom that they feel most comfortable with and that they are protected from violence when it comes to other people not letting them do so, okay? Violence does not necessarily mean physical danger or physical harm. It can be psychological harm. And in this case, it can be physical harm as well. We want to make sure that our young people are physically and psychologically safe when they are coming to us for healthcare services. Record gender identity, pronouns, and patient's chosen name across electronic health records. If there are fields in the EHR that you are unable to change, then use the notes field or use another section where you can add notes to specify that information. If you don't use an electronic health record, flag charts with a sticker to indicate name updates or name alerts to indicate pronouns, etc. Again, everybody has pronouns. Everybody has a gender identity, and all patients have a name that they use. right? So make sure that you're asking these questions of everybody. These should be universal. And the more you universalize these things, the easier you make it on young people to come in and give you that information. If I say, hi, my name is Sasha, I use she, her pronouns. What are your pronouns? That sounds different than when I say, oh, hi, I'm Sasha. So how would you like me to call you when you're not in the room? What's the word you want me to use? Very different ways of framing that question, and make sure that you're asking that to everybody again, because this applies to everybody. Additionally, use patient's pronouns and chosen name at all times. I have heard horror stories of health centers that are supposed to be by and for LGBTQIA plus people using patients' dead names, so the name that they no longer use, to call them out in the waiting room. There is no excuse. It may take a little bit more time on the part of the provider to review the chart instead of making assumptions, but it is crucial because it is traumatizing for a person to mischaracterize the humanity of a trans or gender nonconforming person. It is a source of trauma, and you don't want to be a source of additional trauma for somebody who is already navigating the world as a marginalized person based on their sexual orientation or their gender, etc. Include gender identity, expression, and sexual orientation in anti-discrimination policies across your organization. And make sure that there are accountability measures in place so that folks can be held accountable for when they don't meet those standards, for when they're not following their own policies. Use best practices for forms and documentation. Capture the information you need with respect and accuracy, such as, but not limited to, pronouns, chosen name, gender identity, and assigned sex. And when in doubt, break it down to basics, okay? When we're working with youth, we need to be comprehensive. But when it comes to, capturing this information, feel free to break it down to basics and to put it in simple language. Like instead of saying what pronouns do you use? Without listing examples, list examples. List examples such as she, her, or he, his. Use examples to give the patient an idea of what is being asked of them. And last, we're going to talk about supporting youth on the front line. A young person's experience with frontline staff shapes absolutely everything that comes afterward. One negative experience could make the difference between successfully seeking services and opting not to return. I'm sure all of us are familiar with what it is to be an adult person navigating the healthcare system in the United States. And they don't make it easy. They don't make it easy to understand or easy to navigate. If you are in healthcare, you may have access to more information than those of us who maybe aren't have. And we are frequently left to our own devices to figure these things out with limited information that is seemingly purposefully complicated. Can you imagine what it is to be 16 and having to navigate making phone calls to set up appointments, getting to the healthcare center, wondering whether or not I should go up to the registration desk first before I sit down, not knowing how things work, right? One negative experience might mean that young person doesn't come back. Or one really great experience could mean that they come back And they invite other people to come with them, that they tell other folks, you know, I had a really good experience at this center. If you need an STD test, you know, I'm going to give you their number. That is the difference. It is the difference between affirming a young person's decision to get care and making sure that they get what they need versus making it so that they are absolutely terrified to ever seek services again. So make sure that your staff are receiving regular training and education. Use best practices for affirming LGBTQIA+ patients. Utilize trauma-informed care approaches, because we're all bringing trauma to that space. And we have no choice but to do that and to, you know, move about the world with that, you know, with us. Invite and engage with client feedback via clear, easy to find protocols. Make it easy on folks to tell you what they think, okay? If, you know, it may mean just putting a sign in the the appointment room, a sign in the appointment room that says, you know, your nurse should have washed their hands for this many seconds, and they should do A, B, and C before they start the appointment. And if they have not done this, please email this address or please call this number. It could be as easy as that, okay? To just make it, to literally place that signage where folks are physically at and make it as easy as possible for folks to submit their feedback and then engage with it. Use that feedback to make positive changes to your practice and to your processes. Ensure documentation is consistent and appropriate across the office. That's why it's so important that everybody receives that regular training and education and not just certain folks. Use clients' pronouns and chosen names at all times, not just when they're in front of you. Quality control, you know, that means developing quality improvement processes and protocols. It means using that data in order to actually improve the quality of your services, using that data to make evidence-based decisions about how to improve services. Mystery shopper calls are just one way to do quality control, where you have folks call the appointment line with certain number of questions and see how it goes. You know, maybe they can pose as a young person. I used to do mystery shopper calls in my previous role at Access Matters, and it's certainly a learning experience. You get a lot of information that you might not get otherwise when you are posing as a patient. And create a youth advisory board. You know, young people need to be a part of the planning, monitoring, and evaluation of services. And a youth advisory board is a great way to do that. Invite youth from the community to be a part, you know. In the before times, this might have meant a pizza party. Now it might mean a Zoom session and Amazon gift cards for participants, you know. So there are different ways to go about it, but it is a great way, it can be a great way, an effective way to invite young people to be a part of the process, and while making it worth their time. Your commitment to youth-centered care means a commitment to the principle that young people are individuals with personal autonomy and unique needs and should be treated as such, okay? Young people are human beings too. So often youth have to navigate the adult world, and it's our job to make it easier on them and to make it so that their autonomy is honored and preserved and that their unique needs are met. Youth face numerous barriers in getting healthcare services. It could be transportation, financial ability, fear of discrimination. But your healthcare system or your healthcare center does not have to be one of them. And last, your commitment to exceeding standards of care, centering youth, and serving marginalized young people with dignity and respect will make the difference. Here are some resources for providers as well as youth. Advocates for Youth, they provide a lot of information on sexual health for young people. The National LGBTQIA+ Health Education Center is a program of the Fenway Institute. They have published a manual on best practices for forms, documentation, and providing affirming care to gender nonconforming and trans patients. It is a valuable resource and it is free. So you can log on to that website and get that information, and it is there, it is available, and it is accessible. For youth, these are some websites that are youth-friendly, that have a lot of easy to understand, comprehensive information about sexual health, reproductive health, birth control, HIV, all kinds of different issues, as well as body issues or body image issues, consent. There are a lot of issues that they talk about on these websites in a teen-friendly way, and so these can be great resources as well to pass along to patients. Planned Parenthood, Bedsider, and Scarletine. Scarletine has been around for a minute. I used to visit Scarletine when I was a teen. And so, good resources are the gift that keep on giving, because these are things that folks can pass on to their colleagues or their patients, and then those folks can pass it on to others in their networks as well. So just take a moment, and I want you to think to yourself, what will you leave here today? And what will you take with you? I want to thank everybody for your time. If you have any questions or comments, please feel free to contact me at my email listed up here. I would love to hear from you. And if you need anything, don't hesitate to reach out. Thank you so much. I hope you're taking good care and stay as well as possible. Thank you so much for your time.